Good morning, classmates. Good morning, CIs. I hope all of you are doing well today. We are the Group 2, and the topic that we are going to discuss today is herbal preparation and other healthcare modalities. Let me introduce the group reporters: Mr. Jeremy Brian Arandain, Miss Julie May Chiarez, Miss Thea Louis Mulier, Miss Hannah Marie Trazo, Miss Princess Ayesha Francisco, Miss Weya Kaisa Cañedo, Miss Krishna K. Agbay, and our dear facilitator, Mr. Benedict Dwight Lapitan, RN. Course Learning Outcomes. After 2 hours of various online class activities, the Level 2 nursing students will be able to CLO 1. Define the terms related to herbal medication and other alternative healthcare modalities. CLO 2. Discuss RA-8423 or the Traditional and Alternative Medicines Act of 1999. CLO 3. List down and discuss alternative healthcare modalities as practiced in the Philippines. CLO number 4. State the importance of herbal preparations. CLO number 5. Explain the common methods of preparing and administering herbal medicines. CLO number 6. Enumerate the indications and preparations of the 10 medicinal plants endorsed by the Department of Health. CLO number 7. Discuss the contraindications in the use of herbal preparation. CLO number 8. Explain the scientific principles involved in preparing and administering herbal medicines. CLO number 9. State the guidelines in herbal preparation. CLO number 10. Cite nursing responsibilities in administering herbal medications. CLO number 11. Perform herbal preparation with a family in the community using homegrown herbal plants. CLO number 12. Utilize the knowledge in bag technique in providing care to client using clinical case scenario. I will now proceed to CLO number 1. Definition of terms. Reporter, Mr. Arandain Jeremy Brian M. 1. Herbal preparation. Preparations obtained by subjecting herbal substances to treatments such as an extraction, distillation, expression, fractionation, purification, concentration, or fermentation. 2. Traditional and alternative healthcare. These are the sum total of knowledge, skills, and practices of healthcare other than those embodied in biomedicine, used in the prevention, diagnosis, and elimination of physical or mental disorder. 3. Traditional medicine. This is the sum total of knowledge, skills, and practice on healthcare, not necessarily explicable in the context of modern, scientific, philosophical framework, but recognized by the people to help maintain and improve their health towards the wholeness of their being, the community, and society, and their interrelations based on culture, history, heritage, and consciousness. 4. Biomedicine. This is a discipline of medical care advocating therapy with remedies that produce effects differing from those of the diseases treated. It is also called allopathy, Western medicine, orthodox medicine, or cosmopolitan medicine. 5. Alternative healthcare modalities. Refers to other forms of non-allopathic, occasionally non-indigenous or imported healing methods, though not necessarily practiced for centuries nor handed down from one generation to another. Some alternative healthcare modalities include reflexology, acupressure, chiropractors, nutritional therapy, and other similar methods. 6. Herbal medicine. This refers to finished, labeled, medicinal products that contain as active ingredients cereals or underground parts of plants or other materials or combination thereof, whether in the crude state or as plant preparation. 7. Natural products. This refers to those foods that grow spontaneously in nature, whether or not they are tended by man. CLO number 2. Republic Act number 8423. Otherwise known as Traditional and Alternative Medicines Act of 1999. Its aim is to improve the quality and delivery of healthcare services of the Filipino people through the development of traditional and alternative healthcare and its integration into the national healthcare system. This was done because of Juan Flavier, and this Republic Act created the Philippine Institute of Traditional and Alternative Healthcare, which seeks to further research the other traditional medicine to be able to be integrated in our Philippine national healthcare system. We have now finished CLOs number 1 and 2. Thank you for listening to my report. We shall now proceed to CLO number 3 as reported by Ms. Julie May Chiarez. Thank you.
Good morning, classmates. I'm Miss Julie Charas, and I will discuss CLO 3 and 4. CLO 3 is to list down and discuss alternative healthcare modalities as practiced in the Philippines. So first is the acupressure. So it is a technique similar in principle to acupuncture. The difference is the acupressure uses the finger pressure while your acupuncture uses needles. So it is based on the concept of life energy which flows through the body along pathways or what we call meridians. So what you can see in the picture, there are specific acupressure points in which physical pressure is applied to aim of clearing blockages in these meridians. So its advantages, it is safe, it relieves pain, it cures certain illnesses and promotes wellness. Its advantages, it is limited to specific acupressure points. It is expensive. Some people may feel soreness or bruising at acupressure points after the therapy. So this is the video of acupressure.
To find this point, you just locate it between the two tendons on the inside of the forearm, and it's usually right after the vein crosses, about 1 or 2 finger breadths down. So on our model today, it's located right here. And what you want to do is do some light to moderate pressure on this for about 15 to 30 seconds, and probably about 5 to 10 times in order to get a good effect. This point is located on both wrists and can be used on either one. And I also recommend putting one hand on the belly while you're doing this, and taking some nice deep breaths and just kind of picturing everything coming down. And what this point does anatomically is it has a specific effect on the lower esophageal sphincter.
So next is the acupuncture. So it involves inserting very fine needles into different parts of your body or called the acupuncture points. This is believed to stimulate nerves and muscles which may release natural pain-relieving chemicals. The goal of this care is to recognize and manage the disruption before illness or disease occurs. Its advantages is mainly used to relieve headaches or chronic pain, but some people feel that it helps to relieve symptoms of depression and anxiety. Its disadvantages is when the flow of energy becomes blocked or congested, people experience discomfort or pain on a physical level, frustrated or irritable on emotional level, and may experience a sense of vulnerability or lack of purpose in life on the spiritual level. It can also cause bleeding and infection.
5,000 years. Today, it is more mainstream, and more medical centers are using acupuncture, like California Pacific Medical Center. Acupuncture is one of many tools used in Chinese medicine.
So next is aromatherapy. So it is a therapeutic use of essential oils extracted from plants in which the odor or fragrance plays an important part. The chemicals found are absorbed in the body, resulting in physiological and psychological benefit. The oils can be used in many different ways, such as creams, oil burners, massage into the skin, or by adding drops to a warm bath. So this will be discussed further. And the example pictured is a lavender, in which it is calming a sedative for insomnia. It relieves flu and colds. So the advantages is different oils may calm, stimulate, improve sleep, change eating habits, or boost the immune system. It's the disadvantages that essential oils other than your lavender or tea tree oil are quite potent and can irritate the skin, so they should be diluted with a carrier before being used on the skin. So an example of carrier oils are your sunflower oil, grapeseed oil, or soy oil, which contains vitamins, proteins, and minerals that provide added nutrients to the body. Second is some oils can trigger the bronchial spasm, so persons with asthma should consult their primary health provider before using oils. So next is chiropractic. It focuses on the relationship between the body's structure, mainly the spine and the functioning. Although practitioners may use a variety of treatment approaches, they primarily perform adjustment or manipulation to the spine or other parts of the body. So its advantages is that it corrects alignment problems, eases pain, improves the function, and supports the body's natural ability to heal itself without surgery or medication. Its disadvantages: it may cause unwanted fractures or injuries, so it's important that you only have an appointment with an experienced chiropractor. And next is the cost of treatment can be quite high.
Yeah, like Titanic when she's like, draw me like one of your
I can tell you right there. And so what I'm going to do is I'm basically just going to contact that one area in your pelvis, kind of rock you over, and basically just push it back to where it needs to go. Nice. It's going to be a little bit more like there. Cool. As long as you have them keys in your pocket, we're set. Right there. Good. So right on the S side joint. Perfect. I'm just going to kind of go like that. Yeah, it's already got a little tight.
Oh, yeah.
And she giggles afterwards. Is that painful?
That's my emotional release.
That's the emotional release. So let me go face down again for you. Okay.
So the fifth is a herbal medicines or your phytomedicine. So it refers to the use of plants and herbs for the purpose of cure and mitigation of human illness. It's finished, labeled, medicinal products that contain an active ingredients, cereal or underground parts of plant or other materials, therefore whether it is in a crude state or as a plant preparation. Plant material includes juices, gums, fatty oils, essential oils, and other substances of this nature. So it will also be discussed by another reporter. So its advantages: it is readily available and economical. It treats rheumatism, arthritis, insect bites, pruritus. It relieves pain, headache, stomach ache, coughs and colds, swollen gums, toothache, menstrual and gas pain, nausea and fainting, insect bites, etc. Its disadvantages is not all plant life is beneficial, because most plant-related poisonings are due to accidental consumption of toxic ornamental plants such as your poinsettia. It also can cause serious side effects if taken in excess or if taken over a prolonged period of time. It also results in injuries to health when they are consumed with pharmaceutical drugs. Sixth is your massage. So it is a scientific manipulation of the soft tissues of the body, a healing art, an act of physical caring, and a way of communicating without words. It is believed that massage aids the ability of the body to heal itself, and it's aimed at achieving or increasing the health and well-being. So a lot of types of there are different types of massage therapy, such as your shiatsu, Indian head massage, and aromatherapy massage. So its advantages: It treats several health conditions such as migraines and menstrual pain in women. On the physical level, it relieves muscle tension, reduces muscle spasm, improves joint flexibility and range of motion, improves posture, etc. On the mental level, it induces a relaxed state of alertness, reduces mental stress, and increases the capacity for clear thinking. On the emotional level, it satiates the need for caring and nurturing touch. It increases feelings of well-being. It decreases mild depression, enhances self-image, reduces the level of anxiety, and increases awareness of the mind-body connection. Its disadvantages: it is time engaging, approximately 60 to 90 minutes. It's expensive. Injuries occur due to too much pressure application, wrong strokes, skin abrasion because of the friction, and on the extreme levels, blood vessel can rupture.
The therapist steps out of the room as the client gets ready on the table. The client is fully draped with a sheet and a blanket, or is wearing athletic apparel if necessary. Only the body part being treated is undraped as the therapist works in this area. From Swedish to deep tissue and sports massage to craniosacral therapy, energy work, and myofascial release, we work with you to design the session you want. For some, that may be pure stress-relieving relaxation. For others, it may be an area-specific session focused on one or two body parts. Others request relief from chronic pain or an increased range of motion for easier movement. The benefits of bodywork include improving body awareness, decreasing tension and pain, preventing injuries, and an increase in circulation, among others.
So next is nutritional therapy. It approaches treatment of a medical condition by providing a tailored diet for the patient. In order for the food to be therapeutic, it must be nutrient-dense, measured in parts by the nutrients and anti-nutrients contained in consumed foods. Its advantages that a qualified dietitian will assess your current diet and help you develop a meal plan that will allow you to learn healthier eating habits. It also prevents and reverses diseases such as your diabetes, obesity, heart disease, arthritis, and depression. Its disadvantages: it follows a strict diet to see benefits. It's also high cost on appointments on food. So next is pranic healing. It is a highly developed and tested system of energy treatment that uses prana from the surrounding or the divine sources to balance, harmonize, and transform the body's energy processes. Prana is the Sanskrit word that means life force. This invisible bioenergy or vital energy keeps the body alive and maintains good health. Its advantages is that a pranic healer can do self-healing and can heal ailments of others. He can also give or relieve the children suffering from fever or some wounds or burns. He can also heal headache, gas pains, toothache, and muscles almost immediately. So pranic healers state that there are never any negative side effects, only positive benefits of pranic healing that can lead to boosting the individual's healing process. Although there are some controversies, like the main risk and danger of pranic healing is the approach on the patient or in the client, and it just treats the symptoms, not the disease. So lastly is reflexology. It is based on the idea that different points on your feet, hands, face, and ears are linked to other parts of your body through your nervous system. During a typical session, a reflexologist will use their hands to apply gentle pressure in an orderly arrangement to these points. So, mostly, reflexology is on the feet. So, the advantages is it relieves tension, improves mood, and helps you sleep. It also improves physical and emotional well-being and not at all invasive and no potential to cause ill side effects. Its disadvantages: it is not scientifically proven to mentally or physically improve a person's health. CLO4. State the importance of herbal preparations. So it is effective in treatment of common illness since it treats rheumatism, arthritis, insect bites, pruritus. It also relieves pain, headache, stomachache, coughs and colds, swollen gums, toothache, menstrual and gas pain, nausea, and fainting, etc. It is safe, valuable, and readily available. So herbal drugs have been evaluated scientifically to prove their safety, potential benefits, and effectiveness. The sources of raw materials and herbs and the good practices of manufacturing processes are certainly the essential steps for the quality control of herbal medicines. It is used for first aid treatments. It helps treat insect bites, wash wounds, cuts, burns, and blisters that can speed healing and reduce the risk of infection. Lastly, it used as self-help measures. It is natural and not at all invasive. The use of herbal treatments is independent of any age groups and sexes. Unlike your synthetic pharmaceutical medicines, herbs are easily absorbed in the body and bloodstream, leaving minimal residual and side effects. It also improves the physical, mental, and emotional well-being.
Good morning, everyone. Good morning, CIs, and good morning, classmates. This is Miss Molia Thea Louis, your reporter for CLO number 5, which is to explain the common methods of preparing and administering herbal medicines, and I will also be including the advantages and disadvantages of these common methods, so please listen carefully. First is we have the decoction. Some herbal medicines cannot be made using infusions and require gentle boiling or decoction to extract the active principles. Decoctions are prepared using the more fibrous parts of the herb, such as the roots or bark. Cold water is poured on the herb and the mixture is then boiled. The parts used in the preparation must be boiled for a long period of time to release the active ingredients. The decoction can then be drunk warm. The advantage of decoction is it is more easily absorbed by the patient. After drinking into the stomach, the effective substances in the decoction will be absorbed through the gastrointestinal system and into the blood within half to 1 hour. The result is much quicker than other formulations. The disadvantages of decoction: it requires a little preparation time. The patient needs to spend some time boiling the herbs every day. The other disadvantage, sometimes it tastes, which is usually quite bitter. In this case, you can add some sugar or honey before drinking. Next is the infusion. Herbal infusions are prepared in a similar manner to herbal teas. However, they are stopped longer so they become considerably stronger. Infusions are typically used for dried or fresh herbs, leaves, and plants. The herb is added to boiling water and left to stand. The liquid is then strained and the herbal medicine can be drunk as tea. Advantages of infusion is they are rich in nutrients and antioxidants and vitamins. Multiple health benefits such as pain reduction, relaxation, improving digestive and immune body systems, and many others. In short, they contain multiple gifts provided by Mother Earth in just a cup. Disadvantages of infusion includes water. Water is not a good solvent for many of active components in herbs. This problem is compounded by the relatively short extraction time used in their preparation, usually 5 to 10 minutes. Next is the poultice. A poultice, also called a cataplasm, is a paste made of herbs, plants, and other substances with healing properties. The paste is spread on a warm, moist cloth and applied to the body to relieve inflammation and promote healing. Some can spread directly on the skin. So the advantages of poultice. When using a poultice, you not only get the benefits of the ingredients used, but the only method itself also. The warm poultice increases blood flow to the area, which is an important part of healing. Disadvantage: an allergic reaction is possible when applying any substance directly on your skin. So in this situation, test a small area on your forearm before applying the poultice to the affected area. If you are applying a poultice to an open wound, be sure to use a clean cloth if making a compress. Do not apply any type of paste or cloth poultice to a wound that appears to be seriously infected. Fourth is the extract. Extraction is the separation of medicinal mixture of many plant metabolites such as alkaloids, glycosides, phenolics, terpenoids, and flavonoids using selective solvents through standard procedure. The aim of all solvent extraction methods is to separate the soluble plant metabolites, leaving behind the insoluble cellular mark. So the advantages of extraction or extract is it is used for its antioxidant, anti-inflammatory, antiseptic, and antimicrobial properties. Liquid herbal extracts delivered herbal benefits faster than other forms by removing phytochemicals out of their cellular and structural plant matrices and making them available for immediate absorption. The disadvantages for extract: it has slower effects, requires a long-term therapy, and allergic reaction may occur. Next is the juice. Juice extraction. The elimination of the juice from fibrous solid particles is a basic technological step of fruit juice production. The fruit has to be prepared prior to juice extraction, which is then followed by juice clarification and drink completion. Subsequently, the finished drink is packed and preserved. The advantages of juicing has a variety of benefits, including greater concentration of nutrients per ounce, increased consumption of fruits and vegetables, and enhanced absorption of nutrients. It may also help people who have difficulty eating their vegetables to stomach the taste. The disadvantages of juice. Expense. Juicing is expensive when compared to eating whole fruits and vegetables. It requires special equipment including a juice extractor, quality knives, and storage containers. Second is lack of convenience. Juicing can be inconvenient, time-consuming, and cumbersome. If you don't have time for grocery shopping, perishable food storage, and meal preparation, you will need to buy juices that are already made. Six is the liniment, from the Latin word liner, means to anoint, or embrocation. Is a medicated topical preparation for application to the skin. Sometimes called a heat rub, liniments may be water-like in viscosity, are formulated as a lotion or balm, and are usually rubbed into allow for penetration of active ingredients. Patches, sticks, and sprays are also available. So advantages of liniment. Medicinal substances of the liniment is well absorbed by the skin and have high bioavailability. Compared with other ointments, liniments better applied to the skin, leaving fewer traces on skin and clothing of the patient. Disadvantages includes low stability and inconvenience of transportation. Seven is the ointment. Ointments are preparation for external use, intended for application to the skin. Typically, they have an oily or greasy consistency and can appear stiff as they are applied to the skin. So the advantages of ointments. Handling of ointments is easier than bulky liquid dosage forms. They are chemically more stable than liquid dosage forms. They facilitate application of the directly to the affected body part and avoid exposure of other parts to the drug. Disadvantages. When application of an exact quantity of ointment to the affected area is required, it is difficult to ascertain the same. Next is the fermentation. A fermentation consists of a local application of moist heat to the body surface. A fermentation is usually made of blanket material, 50% wool to retain heat and 50% cotton to retain moisture and be more durable. So the advantage of fermentation is great for pulled muscles and joint sprains as well as for nausea or diarrhea. The advantages of fermentation is it may be initially hot, but preparing them takes more time than for silica gel packs. They cool off faster. Fermentations can cover larger area and drape to fit body curves, but they are very or sometimes hot and not really that ready to use. Nine is we have the tincture. A tincture is typically an extract of plant or animal material dissolved in ethanol or ethyl alcohol. Solvent concentrations of 25 to 60% are common, but may run as high as 90%. In chemistry, a tincture is a solution that has ethanol as its solvent. In herbal medicine, alcoholic tinctures are made with various ethanol concentrations, 20% is being the most common. So tincture may make it easy to consume the natural health-boosting chemicals found in the same plants. They are usually inexpensive to make and can be easily prepared at home. So the disadvantages of tincture: in some people, herbal remedies may interact with medications. Depending on the medication, this may cause blood clotting problems, liver damage, and increased effects of medication. Ten is the latex. A latex is found in nature is a milky fluid found in 10% of all flowering plants angiosperms. It is a complex emulsion consisting of proteins, alkaloids, starches, sugars, oils, tannins, resins, and gums that coagulate on exposure to air. It is usually exuded after tissue injury. The advantages of latex includes these are natural agents, induce healing and regeneration of the lost tissue by multiple mechanisms. Not only cheap and affordable but are also safe. It is a good therapeutic alternative in cases of wounds. The disadvantages includes lack of measurement for specific supplement, discourage the extensive use, otherwise loss of biodiversity will increase. Probably more effective if used with consistency for a longer time. But again, it depends on the type of medical history of the patients. Next is we have the plaster. Contain herbal preparations such as dry or soft extracts on pieces of fabric or plastic elastomer sheets in such a way as to adhere to the skin and attach backing. When applied topically to the skin, they deliver the active ingredients through the skin to underlying tissues, usually for the relief of pain, backache, or sore muscles. So the advantages of plaster includes it is placed directly over the painful area, safely added to an existing pain treatment plan without worry about drug-to-drug interactions with other body-wide systemic analgesics. The risk of unwanted body-wide side effects is also significantly reduced. Can be obtained as both prescription and non-prescription, and lastly, generally easy to use and begin to work relatively quickly. Disadvantages: does not reach the bloodstream in any amount to produce any meaningful effect. Care must be taken when applying topical medications because application of excessive amounts for extended periods of time over a larger area can promote increased medication penetration and result in amounts in the bloodstream that cause side effects. Skin patches may cause the skin area to become pale, itchy, red, or inflamed. And lastly, if the skin is oily or hairy, it may be difficult for the patch to stay in place. Next is the syrup. Syrup is one of the yummiest herbal preparations. These are easy to make and delicious for the whole family. Syrup is a concentrated extract of herbs cooked into a sweet medicine with the addition of sugar, honey, or fruit juice. Maple syrup, agave syrup, date syrup, glycerin, and similar can be substituted for honey and sugar. Because syrups are thick, they coat the airways, delivering the healing process of herbs direct to the area, so are ideal for sore throats and coughs. So advantages of syrup, due to the sweetness, can mask the taste of salty and bitter drugs, and therefore serve as a pleasant tasting vehicle. Used as vehicle for pediatric use due to their high viscosity and the smoothness and mouthfeel qualities. Enhance the flavor due to the wide variety of flavors of syrups such as orange, lemon, peppermint. These are widely acceptable. Disadvantages: caramelization, dehydrated and polymerized sugar, crystallization, precipitation, microbial attack, infection and degradation, cup blocking, handling issues, and lastly, diabetogenic, which is the therapeutic issues. Next is resin. Are obtained by different methods. These are complex chemical products produced by specialized ducts, cavities, or metabolic byproducts of trees and other plant forms, are insoluble in water, and are usually hard, transparent, or translucent. When heated, they soften and usually melt. Their chemistry is elaborate, containing mixtures of resin, acids, alcohols, tannins, esters, and other compounds. So the advantage of resins, it improves the body's response to environmental and metabolic stressors. And for this advantage, it can cause allergy due to the complex chemical products that it is produced by specialized ducts, cavities, or metabolic byproducts of trees and other plant forms. Next is the washes. Herbal washes, compresses, and fermentations are essentially herbal infusions, but instead of using them internally, we use them externally on an area of the body. This allows the constituents of the herbs to readily absorb into the skin. These preparations can be used to cleanse the wounds, increase circulation, relax sore muscles, as well as a wide range of other uses and applications. For the advantages of washes, it includes quick, cheap, and easy, and it requires no special expertise nor any special equipment or ingredients. For the disadvantages of washes, it includes excessive amounts or extended periods of usage can lead to skin problems, and also allergic reactions may occur. We have the oil. An herbal infused oil, also known as macerated oil, is carrier oil that has been infused with the goodness of an herb or a flower. Herbal oils, also called oil extracts, are traditional herbal remedies used to treat several conditions. Beneficial effects are achieved through the combination of nutrients, antioxidants, and biostimulants obtained from herbs using gentle, non-destructive oil extraction techniques. For its advantages, it is rich in vitamins, minerals, and antioxidants with extended benefits to the skin, can obtained as both prescription and non-prescription, and lastly, generally easy to use and begin to work relatively quickly, and can be used in a wide variety of applications such as aromatherapy and massage therapy. So its disadvantages is it may cause allergic reactions and benefits are only limited on the skin. Lastly, the elixir. Elixirs make excellent food like medicines and can be prepared from a variety of herbs, especially aromatic plants or tasty berries. Generally made with the folkloric method, elixir recipes can be considered more of a culinary art than a precise science. Precise, I mean. They are very useful in helping children and picky adults adjust to the taste of herbal medicines, especially where repeated doses of tonic or preventative remedy is needed. So for its advantages, it can be customized for any dietary restrictions such as keto, vegan, sugar, dairy, and or nut-free. Health goal like clear skin, increase energy, reduce hot flashes. It is also perfect coffee replacement. It has a great alternative to supplements. And its advantages, allergic reaction may occur and causes dizziness or drowsiness. So sources, I have the well-being team and the enhancers green. So this will be the end of my discussion. Continue to listen to the next reporter. For now, stay safe, stay at home, and have a good day. Thank you.
Hello everyone, I am Hannah Marie Trazo and I will be talking about CLO number 6, enumerate the indications and preparations of the 10 medicinal plants endorsed by the Department of Health. So herbal preparation was discussed in the previous slides. So the first is the Lagundi or the Vitex Ligundo. It is used to treat asthma, cough, and fever. And preparation is decoction by boiling raw fruits or leaves into glasses of water for 15 minutes. It is also used to treat dysentery, colds, and pain. Through decoction by boiling a handful of leaves and flowers in water to produce a glass. It has to be taken 3 times a day. It is also used to treat skin diseases like dermatitis, scabies, ulcer, and eczema. And its preparations are washes and decoction. In here, the decoction is used to wash and clean the infected or affected wound or skin of the patient. Then, it is also used to cure headache by crushing the leaves, and it may be applied on the forehead. It is also used to treat rheumatism, sprain, contusion, and insect bites by crushing the leaves or pounding the leaves and applying it on the affected area. The next is the yerba buena or the buena menta cordiphilia. It is used to treat pain like headache and stomach ache through decoction by boiling chopped leaves in 2 glasses of water for 15 minutes. And by dividing the decoction into 2 parts, drink 1 part every 3 hours. It is also used to treat rheumatism, arthritis, and headache through extraction by crushing the fresh leaves and squeeze the sap. Then massage the sap on painful parts with eucalyptus. Cough and cold is also indicated with its preparation through decoction by soaking 10 fresh leaves in a glass of hot water and drinking it like a tea. It is also used to cure swollen gums through decoction by steeping 6 grams of fresh plant in a glass of boiling water for 30 minutes and then use it as a gargle solution. Then the next is toothache. It is prepared through extraction by cutting fresh plant and squeeze the sap. Soak a piece of cotton in the sap and insert this in the aching tooth cavity. Menstrual and gas pain is also indicated and prepared through infusion by soaking a handful of leaves in a glass of boiling water and drinking it. It is also used to manage nausea and fainting by crushing the leaves and applying it on the nostrils of the patient. Then insect bites is also indicated by crushing the leaves and applying the juice on the affected area, or by pounding the leaves until it is like a paste and then rubbing it on the affected area. Last is pruritus, and is prepared through decoction by boiling plant alone or with eucalyptus in water, then use decoction as a wash on the affected area. So the next is sambong, or the Blumea balsamifera, for anti-edema, diuretic, and anti-urolithiasis. Prepared through decoction by boiling chopped leaves in a glass of water for 15 minutes until 1 glassful remains. Divide decoction into 3 parts, then drink 1 part 3 times a day. Diarrhea is also indicated, still prepared through decoction by boiling chopped leaves in a glass of water for 15 minutes. Drink 1 part every 3 hours. The next is the chaanggubat, or the Carmona retosa, used to treat diarrhea, and its preparation is decoction by boiling chopped leaves into 2 glasses of water for 15 minutes, then divide the decoction into 4 parts. Drink 1 part every 3 hours. Stomach ache is also indicated, still having decoction as the preparation by boiling chopped leaves in 1 glass of water for 15 minutes. Let it cool and then strain. Next is the niyug-niyugan, or the Quisqualis indica L. It is for antihelmintic, so the seeds has to be taken after supper, 2 hours after supper. If no worms are expelled, then the dose must be repeated after 1 week. But it shouldn't be given to children below 4 years old. The next is the bayabas, or Psidium guajava L, indicated for washing wounds through extraction by chopping or pounding guava leaves. This may be used twice a day. It is also used to treat diarrhea through decoction by using the leaves for tea. It may be taken 3 to 4 times a day. Then it is also used for gargle and for treating toothache through the use of decoction, or the preparation as decoction. Warm decoction is used for gargle, then freshly pounded leaves are used for toothache. Boil chopped leaves for 15 minutes at low fire, then do not cover and let it cool, and then strain. The next is Acapulco, or Cassia alata L, for antifungal, includes Tinea flava, ringworm, athlete's foot, and scabies. Its preparation is by pounding the leaves. Fresh, matured leaves are pounded. Apply soap to the affected area 1 or 2 times a day. Next is the Ulasimang bato, or pansit-pansitan, Peperonica pellucida. Lowers the uric acid. Its preparation is decoction. Boil 1/2 cup leaves into 2 glasses of water over a low fire. Then do not cover the pot. Then divide the decoction into 3 parts and drink 1 part 3 times a day. Next is the bawang, indicated for hypertension. May be prepared by frying, roasting, or soaking it in vinegar for 30 minutes, or blanching it in a boiled water for 15 minutes. You can also take 2 pieces 3 times a day after meals. Toothache is also indicated by pounding a small piece of garlic and applying it to the affected area in the tooth cavity. The last is the ampalaya, or the Momordica charantia, indicated for diabetes mellitus patients, mild non-insulin dependent. Prepared through decoction by chopping leaves, then boiling it in a glass of water for 15 minutes. Do not cover, let it cool and strain. Then take 1/3 cup 3 times a day after meals. So that's it for the 10 medicinal plants introduced by the Department of Health. Now I will be talking about other herbal plants utilized in other countries. So astragalus, used as an adjunct to boost immune system. Chamomile, used to treat sleeplessness, anxiety, and stomach or intestinal ailments. Cinnamon, treatment for bronchitis, gastrointestinal problems, anorexia, and diabetes. Echinacea, treatment for colds, flu, infections, and skin problems like acne. Ginger, treatment for post-operative, pregnancy-related, chemotherapy-related nausea, motion sickness, and diarrhea. It provides reliefs from pain, swelling, and stiffness of osteoarthritis and rheumatoid arthritis. Ginkgo, treatment for asthma, bronchitis, fatigue, and tinnitus. Ginseng, used to boost immune system, increase person's sense of well-being, and increase stamina. Hawthorn, treatment for heart disease, digestive issues, kidney disease. Then licorice root, treatment for stomach ulcer, bronchitis, sore throat, and viral hepatitis. Milk thistle, to treat cirrhosis, chronic hepatitis, and gallbladder disorder. Then peppermint, to treat nausea, indigestion, irritable bowel syndrome, cold symptoms, headaches, and muscle and nerve pain. St. John's wort, to treat mental disorder, nerve pains, malaria, sleep disorders, and wounds. Turmeric, to treat heartburn, stomach ulcers, gallstones, inflammation, and cancer. Then the last is valerian, to treat insomnia, anxiety, headaches, depression, irregular heartbeat, and tremors. So that's it for the other herbal medicines utilized in other countries. Hello, this is still Miss Trazo, and I will be discussing CLO number 7, the contraindications in the use of herbal preparation. Taking a herbal medicine may not be suitable for, first, people taking other medicines. Herbal medication should be avoided because they might have drug interactions with certain or common medications. The most common illness among patients who experience a drug-herb interaction was cardiovascular disease. In these patients, interactions affecting warfarin or statins were most common. Herbs that interacted with these drugs included sage, flaxseed, St. John's wort, cranberry, goji juice, green tea, and chamomile. Second is people with serious medical condition. Medications taken for these conditions may interact with herbal medication and might cause greater harm to the patient. Example of such is St. John's wort, which interacts with medicines prescribed for kidney disease. Also, some of these herbal medications which contain minerals like potassium, which is harmful for people who have kidney disease. Next is people who are going to have surgery. Some herbal medicines might interfere with anesthesia and other medicines used before, during, and after surgery, procedures or surgery. Some herbal medicines may interfere with blood clotting and blood pressure, which may increase the risk of bleeding during or after surgery. Many health organizations advise that all herbal supplements may be stopped 2 to 3 weeks before surgery. Interference of the herbal medication might cause danger to the patient's life while undergoing surgery. Next is for pregnant or breastfeeding women. Properties in a particular herbal medications may cause side effects to the pregnant mother, which may bring danger to both mother and the fetus. Though most pregnant women prefer herbal medicines in the belief that herbs are safer for the fetus than the modern medicine, but unknowingly it is not, and it could be fatal to some. Most pregnant women didn't tell their OB or their physicians of the herbs they took and when complications arise, it may be dangerous to them. Not just to them, but also for the fetus. Next is for the elderly. Most elderly have maintenance medication due to the illness they have developed. Taking herbal medications should be avoided because drug interactions may happen with one of the drugs and it may bring them danger. Information online are also often misleading. People tend to follow more on the online procedure, which could be dangerous. Today, affordability and apparent benefits without side effects entice customers to use these readily available products. The paradox is that while some herbs can be helpful, others are harmful. This is an especially important topic among older adults because this age group is among the largest user of herbal supplements. The last is children. As to with all medicines, herbal medicines should be kept out of sight and reach of children. Dosage of medicinal plant may not be accurate for babies or children also, thus it should be avoided or they should not be included in taking some of the herbal medications. And if children accidentally swallow the medications, if it is in their reach, then it may cause serious side effects or serious effects that may lead it to danger. That's it for the contraindication of taking herbal medication.
Good day everyone, I am Princess Ayesha A. Francisco and I will be discussing about CLO number 8. Explain the scientific principles involved in preparing and administering herbal medicines. Plant taxonomy. Proper identification, description, and classification of plants with medicinal values from poisonous plants. Plant taxonomy plays a pivotal role in identification of medicinal plants. Possible causes of misidentification includes contamination of cultivated plants with weeds, and resembling plants mistaken for herbs collected in the wild. Botany. Ensuring that the prepared herbs are well identified and has a medicinal characteristics. Verify the authenticity of medicinal plant parts. Herbal medicine requires an understanding of both traditional and therapeutic methods and botany and chemistry of medicinal plants. Pharmacology. Identify the different herbal medication conventional drug interactions. To indicate herbs that may have harmful interactions with prescription drugs. To make drugs safer and more effective. The issue of herbal medicine drug interactions has generated significant concerns. Such interactions can increase the risk for the patient, especially with regard to drugs with a narrow therapeutic index. Microbiology. The preparation of an herbal medicine should involve the steps in which the herbal is subjected to unfavorable conditions to inhibit survival of microorganisms. Medicinal plants may be associated with a broad variety of microbial contaminants, which are represented by bacteria, fungi, and viruses. Inevitably, this microbiological background depends on several environmental factors and exerts an important impact on the overall quality of herbal products and preparations. Anatomy and physiology. Anatomy. For better understanding of how to take care for herbal plants and fight against plant diseases. It helps in proper characterization wherein scientists and plant breeders find clues for development of new varieties resistant to diseases or drought. Physiology. Identify physiological responses to herbal medicines. To understand how the plant grows up and how it reproduces. The functions of plant organs determine how plants adapt to different habitats, how plants conduct metabolic processes to produce energy, and how this energy transfers. Safety and security. Do not use herbal medicine if contraindicated. Some herbal medicine may cause allergies and other reactions. Do not assume that just because they are herbal medicine, they are automatically safe. Interaction with other drugs, such as antagonism or synergism, and medical tests that potentially lead to misdiagnosis. Time and energy. Follow the proper procedure in the preparation of the herbal medicine. Cluster all equipment needed in one place to avoid unnecessary expenditure of energy and to save for time. This is important so that the nurse can finish his or her task on time and preserve their energy for their next task.
Good morning, everyone. My name is Wea Kaisa P. Cañedo, and I will be your reporter for CLO number 9, which is to state the guidelines in herbal preparation. So in the first section, we have growing, cultivation, and harvesting plant materials. So here are the guidelines. First is to remove rotting of leaves and throw away herbs infected with molds. So this is to make sure that other plants will not be affected. Second, leaves and stems are best collected during daytime and when the plant is about to bloom. So the heat of the sun causes essential oils to vaporize and fill with air with their aroma. For this reason, it's best to harvest herbs in the morning while the leaves are still saturated with flavor. For the second section, we have handling plant materials including drying and storage. So first, store herbs in airtight glass jars or plastic bags in a cool, dark, and dry spot. So this way, it preserves as much of their medicinal properties. So second, preserve herbs by air drying or using low heat. Drying concentrates the flavor of herbs, so you may need only to use 1/3 to 1/4 the amount of fresh herbs in recipes. And lastly, label the container properly with the name of the plant and the date when it was collected. So this can help you stay organized, learn faster, cut down on time wasted, and make sure you get the most benefit from the medicines with less risk. For the third section, we have identification, gathering, and collection of specific parts of the herb. So first, identification. You must make sure that you know exactly which plant to use to treat a problem. Second, the names of plants vary from one place to another. Third, different plant name species may have the same local name. And lastly, the botanical name of each plant used in these manuals is given with each remedy except for the most common plants. Next is the collection. So first, you must avoid collecting plants in a way that kills the plant or damages its surroundings. And second, before collecting any, determine first how much of the plant and what parts are needed to prevent wastage. So for instance, if you only need the leaves, take only the leaves and only the number that you need. And medicinal plants should be conserved to ensure their continuous supply. So for the fourth section, basic preparations and herbal preparations. So if dried plants are used as a substitute for fresh parts, adjust the quantity or the weight since water is lost during drying. And for the fifth method or section, actual applications of herbal medicines. So first, we must follow recommended dosage and methods for herbal preparation. Second, we must refrain from continuing two or more types of herb in one mixture. So in relation to the first statement, this is to make sure that clients will not obtain any adverse reactions. And for the third one, take herbs with warm water then simmered with a lid on for 20 minutes to a half hour. So as this method separates the composition of the herb quickly for better absorption. So that's all, guys. Thank you, and we will have Miss Agbay to report CLO number 10. Thank you.
Good day, everyone. I am Krishna Agbay, your reporter for CLO number 10, which is Site Nursing Responsibilities in Administering Herbal Medication. So prior to administration of herbal medication, ask for the client's full medical history, including making a list of herbs the client currently uses. Checking of client's medical history will help you determine what herbal medications is indicated or contraindicated to the client. Second, wear personal protective equipment or your PPEs, such as gloves, head or hair covering, footwear, and etc. This is to prevent cross-contamination. Third, prepare all the materials needed. Preparedness and collecting all the materials needed would save time and energy. Fourth is do medical hand washing. This follows the principle of microbiology and prevents the spread of microorganisms. During the administration of herbal medication, first, provide psychological and emotional support for patients. As much as possible, talk to your patients, for this will somehow provide comfort to them. Second, use the least invasive medication procedures possible to encourage a patient's healing or continuing good health. Minimally invasive treatment options will have less risk of infection and significantly less pain and scarring. Once the administration of herbal medication is done, these are the nursing responsibilities that must be observed. First, after handling herbal processing and herbal medicine, do medical hand washing. Second, do aftercare. Third, do health teaching. Nurses should provide advice to clients regarding when to seek conventional therapies or complementary or alternative medicine therapies, because these therapies might help clients calm their emotions, relieve anxiety, and increase clients' general sense of health and well-being. Fourth, help clients make informal choices about their healthcare. By involving clients in decision-making about their healthcare, we can be able to help improve health and well-being, improve the quality of care, and ensure that clients make informed use of available healthcare resources. Fifth, document the process. Clear and concise documentation is critical to providing patients with quality care, mitigating malpractice risks, and help nurses to evaluate and plan the patient's treatment and maintain the continuum of care. That will be the end of my report. Thank you and God bless.